Today we will discuss about diabetic foot. Diabetic foot is a very common clinical condition that one often encounters in surgical ward as well as in surgical super specialties like plastic surgery, vascular surgery. And this diabetic foot results due to poor glycemic control over a period of time, especially in type 2 diabetes mellitus. Diabetes foot is associated with the diabetes mellitus and is defined as ulceration, infection, or destruction of deep tissues of the foot, usually in the presence of peripheral neuropathy or peripheral arterial diseases. It represents the end results of long-standing diabetes leading to non-healing ulcers and risk of amputations where there will be loss of sensation, poor blood supply, and infection acting together. The classification of diabetic foot. Vaginous classification. It is very simple and widely used. Grade 0 is high risk foot with no ulcer. Grade 1 is superficial ulcer. Grade 2 is deep ulcer reaching tendon, bone, or joint. Grade 3 is deep ulcer with abscess or osteomyelitis. Grade 4 is localized gangrene, forefront or heel, and grade 5 is gangrene of the entire foot. So, coming to the University of Texas grades. Okay, so it is simultaneously classified into grade 0, 1, 2, 3, as well as A, B, C, D. So in stage A, there will be pre or post ulcerative lesion completely epithelialized. And in grade 1 of stage A, there will be superficial wound not involving tendon, capsule, or bone. Grade 2, wound penetrating to tendon or capsule. In grade 3, there will be wound penetrating to bone or joint. So this is in stage A. In stage B, it will be associated with infection. In stage C, it will be associated with ischemia. And stage D, it will be associated with infection as well as ischemia. Coming to the PEDIS classification by International Working Group on Diabetic Foot. PEDIS stands for perfusion, extent, depth, infection, and sensation. So here in grade 1, there will be no peripheral arterial disease. In grade 2, PAD present but no critical but not critical. The ankle pressure is greater than or equal to 50 mm Hg. In grade 3, there will be critical limb ischemia. Ankle pressure is less than 50 mm Hg or toe pressure less than 30 mm Hg. In grade 4, severe ischemia with gangrene will be present. Coming to the extent ulcer, if it is less than 1 centimeter square, it will be grade 1. In grade 2, it will be 1 to 3 centimeter square. Grade 3, it will be greater than 3 centimeter square. And extensive ulcer involving large area of the foot. Superficial ulcer in skin only. And if it is in grade 2, it involves a tendon as well as muscle. In grade 3, there will be reaching bone or joint. Grade 4, extensive destruction of the foot structures. Infection, no infection, mild infection, moderate infection, and severe infection with the systemic toxicity or sepsis in subsequent grades. In sensation, the protective sensation is intact in grade 1. Loss of protective sensation in grade 2, neuropathy in grade 3 with the deformity and pressure points, and grade 4 there will be Charcot and neuroarthropathy. So coming to SINBAD components, SINBAD stands for site, ischemia, neuropathy, bacterial infection, area, and depth. So the location of ulcer, if it is in forefoot, score is 0, and midfoot or hindfoot, it is 1. And in based on blood supply, if pedal pulses are palpable, it is score 0, and the score 1 will be given if pedal pulses are absent or ischemia is present. In case of neuropathy, if there is loss of protective sensation, score will be given. And for clinical infection, if it is present, a score will be given. And if it is greater than 1 centimeter square, score will be given. And depth of ulcer, if it reaches beyond the skin and subcutaneous tissue by reaching out through muscle, tendon, or bone, it will be score 1. So SINBAD scoring, each parameter will be 0 to 0 or 1 and a total score of 6. And higher the score, the worse the prognosis. So to sum it up, there are four systems of classification commonly used: Vaginous classification, University of Texas classification, PEDIS classification, and SINBAD classification. And coming to the main basis, Vaginous classification is based on depth of the ulcer and gangrene, whereas in Texas it is based on depth, infection, and ischemia. And PEDIS, it is based on perfusion, extent, depth, infection, and sensation. SINBAD is site, ischemia, neuropathy, bacterial infection, area, and Wegener. It is very simple and easy to remember, widely used in clinical practice, good for accessing severity, but it does not access infection or ischemia, poor predictor of outcome, limited in treatment guidelines. Whereas here it is slightly complex and requires assessment of ischemia or infection, but less suitable for rapid bedside scoring like the Wegener's test. And coming to PEDIS, it is a standard internationalized system, detailed and reproducible, useful for research as well as documentation purpose, but very complex for routine use, time consuming, and not ideal for emergency settings. SINBAD is very less detailed, limited guidance for management and planning, does not include grade severity within each parameter. But it is very simple website scoring, easy comparison across population, and useful in resource limited settings. So to summarize, Wegener's classification is based on depth, Texas classification is based on depth, infection, and ischemia. PEDIS is internationally standardized, and SINBAD is simple website scoring test. So I hope you have learned through this presentation. Thank you for watching.